Great. And we're so excited that we're able to be back here having the Health Expo this year after the pandemic. So, can y'all talk about how the pandemic has actually affected the way mental health services are provided at St. Bernard's?
One of the biggest ways that it has affected us is that we've started to utilize telehealth services. Prior to the pandemic, some physicians use telehealth. That means you see a patient from a different location, and it's either over the phone or a video conferencing app. But it's usually used in rural areas where people didn't have access to face-to-face visits. Well, when the pandemic happened, due to social distancing and clinics closing down and just for safety reasons, we switched really quickly to telehealth. That way we could continue to have the services that the patients needed, increasingly so during all the struggles they were facing during COVID. And so telehealth has been the biggest change that we've rolled out since COVID.
Awesome. So, do you think telehealth is as effective therapy as in-person therapy?
Yes, it is. Actually, a lot of people think that telehealth is not as efficient as in person, but studies have shown for years that it is, and it has been used, like I said, for years in rural areas. But now that it's been more broadly used, research continues to support that it is as effective as in person. We've actually seen some very positive results from telehealth since the pandemic. Some of those include lower no-show rates. People are keeping their appointments. Some of the barriers prior to treatment were transportation or not having gas money, or if you feel depressed and you just don't feel like you have the energy to get up and take a shower, then you would miss your therapy appointment sometimes. Well, when you have telehealth, it's really easy because you can go anywhere in your house and switch on your device and have your therapy from your home. And then it removes a lot of barriers for people.
So, it sounds like people have responded positively to telehealth.
Yes. I mean, we've definitely had some people at first that really were resistant and did not want to do it. But now more people, I would say, do enjoy it. And some people are asking if they can continue after it's over.
So, do you think that telehealth will continue after our pandemic is over?
Yes, I think it's going to continue in the foreseeable future. We do have people that don't have the internet or smartphones, and so they have therapy over the phone. Mm-hmm. And that's also included in the studies that talk therapy, even over a telephone, is just as effective as not having therapy at all. And it's just as effective or more so than people coming in person. Because what studies show that even when you can't see the person and you're on the phone, you pay more attention to the tone that's used, the words that are used, and people really pay attention when they're having to listen to things instead of having to just watch. So actually telephone sessions have actually proven to be just as beneficial.
And just this week, I have had someone say that they wouldn't be participating in therapy if they weren't able to participate with telehealth. So,
yeah, honestly, when we first went to it, I'm just going to share personally, I was like, no.
Yeah, I was
this
too.
This is not going to work. Everyone thought it was going to be a nightmare, that no one would want to do it. And the therapists were saying the same thing. They're like, people are not going to be able to feel connected. It just feels so impersonal. But then we started doing it, and we realized, wait a minute, this is actually really good. People almost feel more comfortable sometimes at their home because they're in their home base. You know, they're in their house, they're in their room, their bedroom, whatever. It's also made it more convenient for people that are having therapy at work on their lunch break. If a therapy session's an hour and you have a 1 hour lunch break, then it's really hard to get back and forth and not be late for work. So when you have telehealth, you can literally clock out, go sit in your car, or if you have an office, close your door and have your therapy right there, you know, at your workplace, and you don't have to miss any time at work. So we have some major benefits from that.